solo nei sa whaafonga mai le o tal noa I le pale mai o se tasi o te mali foi ia le whiunga Fepulea'i Margie apa e se tasi o te whinga mo lungo I tono se fua malaloina a New Zealand o te lo se whiwhianga tele mo tātou I le pale mai o le whiunga Fepulea'i I lea foi te whinga mo lunga mo tātou whiwhianga whatas mai le whiunga Fepulea'i Margie apa mo le tātou tataranga nei foi tai a whau Fepulea'i whafte tele lava. Thank you so much for joining in our program this morning. Ta alofa lava malo se fua manuia.
Alo lava soifua manang mama. Talofa lava to all your listeners this morning.
Malo, once again, thank you. Mole fatas malne for itaya. Well, I guess a week of celebration and achievements. Congratulations. Fepulea'i. Now, let's talk about the counties in Monaco DHB is now reaching 90% fully vaccinated. What would you like to say about this, Fepulea'i?
Community. Taua lava le 90% 90% uma tato community. It's what we call herd protection. So there's more protection for all of our community. So thank you, Malo. Lava le osai tato providers, South Seas, Fono, Beta Drive, Health Pacifica, all the providers that have helped run all the events, all our community who came out and brought their families to get vaccinated. It's still really important. For Pacific people, we've hit 90% first dose, but we need our community to come out and get the second dose. And because of Omicron, it's our lovely booster. So we need our community to come out and get the booster as well.
Yeah, okay. Talking about the booster, the announcement yesterday, Olela Pharmacina, the second dose. Well, are you happy with this?
Yes, we are. We do want to protect, and also the vaccine's going to be available for children next year. So we want to vaccinate our children 5 to 11. It's not mandatory, so the government has said that parents can make that decision. But we do need everyone to come out next year to get the second and the third dose, the booster.
Yeah. Okay. I wonder if you want to say something about those who are still not having their first or second dose. Well, do you want to say something about them or?
Yes, look, my only words is, don't be afraid. If you want to have a talk to someone to help you make the decision, talk to your doctor or your nurse or many of our providers have excellent health professionals who can speak in Samoan as well. Don't just sit there and worry. Reach out and get some help and get the information you need. Have a conversation with someone so that you can make the right decision for you and your family. It's important for our community to know that I'm in Middlemore at the moment. Most of the people who come into Middlemore because they are very sick are people who have not had the vaccination. So the vaccination does help protect you from becoming seriously sick if you do get COVID.
Another thing, vaccinations for the children under 12 from January next year. Do you really support this? More tātou whanau Samoa Pacifica?
Yes, absolutely. There have been millions of doses given to children in the United States. And the good thing about New Zealand, we look at see what's happening overseas first. We have many scientists and doctors who are looking at the evidence, looking at the numbers, looking at whether anybody got reactions. And so, we are at a level where the government and all of our science community are now saying, yes, it is safe to bring to New Zealand. So I would, and I've read my way through the evidence because I wouldn't recommend it to our community without having read the papers myself. And I highly, encourage our families to talk to each other, to talk to the professionals, and to come to a decision about vaccinating your children.
Okay, let's talk about your new job, Chief Executive of Health New Zealand. Is it fair to say dream comes true?
It's a very, look, Counties Manukau Chief Executive is one of the best jobs I've had, and I love working for our community. But this new job is going to help because it is a job that will merge all the district health boards.
Yeah.
And we will be able to make it easier for across the country for all Pacific people to get better care because of the changes we can make as a country. Sometimes because there are 20 DHBs, we have to argue among ourselves, talk to 20 different DHBs on whether they will or won't. Even in Auckland, we have 4. We have to agree if we're going to do things together. In the new environment, we will be able to work to make that easier for our community. So if you live in Otara, but you have family in Wellington or Hawke's Bay or West Auckland, they should get the same kind of care as you're getting here, if not better.
If I'm right, you are the first Samoan in Pacific Island to hold the Chief Executive of Health New Zealand. Well, I know it's going to be a big job for you. What is your main focus for our Samoan and Pacific Island people, please?
It is the first time this job has been created. So I'm the inaugural or the first chief executive. That is correct. And what our Pacific people should expect to see is much more access to care, so that we should make it much easier for people to get into hospital when they need to see a specialist, to get their surgery. And also that our providers, our Pacific providers, will be resourced, because in the new environment, if we know that our community providers are doing a really good job, we should be funding and resourcing them better so they can continue. And especially this coming year, we've got children's vaccination, we've got boosters. We also have to catch up on a lot of work. Many of our people have not been able to come into hospital because we've had to restrict the number of people. So we want to be able to get back to providing all that care that people are waiting for.
Excellent, Fepulea'i. Okay, now finally, we're now heading to the festive season, and also the orange traffic light system on the 30th of this month. Any special message from you, Fepulea'i?
Yes, so orange at orange, we can do things that we normally do, like church, work, hang out with our family. But it is important that you have your vaccine pass, because some places will only allow that to happen if you have a vaccine pass. So important for our community, but also important to remember that our the GP clinics are closed for about 4 days. So if there are people who have medicines, make sure you have your scripts and your medicine, so you don't run out during the Christmas and New Year season. Get all that you need from your doctors. You've got 2 more days while the practices are open. Get all your medicines, get all your scripts, and just take care. Look after yourself. Don't go out there. Don't go out and injure yourself playing volleyball with your kids and your nephews, nieces. Just look after yourself and take it easy, and don't eat too much.
Okay, anything else you want to talk about before we finish?
Just a big Merry Christmas, and we look forward to seeing you all next year.
Okay, Fepulea'i, once again, congratulations. And from the management and staff of Radio Samoa, we also wish you Christmas, and also all the best for the new year.
Thank you.
Fepulea'i Margie,